Good morning, good afternoon, good evening, everybody. My name is Dr. Kavosa Mudoga of Action for Protection of Animals Africa, and I'm here to present before you the dog population findings for a survey we did for AU-IBAR to determine the institutional preparedness of African countries to eliminate rabies by 2030. So before you the people who worked on this survey, all the authors. So now the strategy objective was basically to support the development of a continental dog-mediated rabies elimination strategy, which the AU-IBAR wanted to do for Africa. And this is going to connect with regional economic rabies strategies, which will connect now to individual countries' rabies elimination strategies. So now the objective was to do a literature review on rabies and dog population management, understand the policy, institutional preparedness by 2030, and do specific country profiles for each country. So as the AU-IBAR works and partners in these countries, they'll understand specifically what their need requirement is in this process in specific countries. So now the study output was a landscaping of the policies and institutions by 2030 in Africa. And we had a separate abridged version because this document was very large. Then we had a baseline survey from the questionnaires that we did from the CAP survey, and then we had the individual country profiles, and we were able to do 43 out of 54 African countries. So the methodology was one, a literature review, two, a CAP surveys in Kobo Collect. We had 58 respondents. 43 of them were county veterinary officers who did it in conjunction with the country public health or medical health officers in their countries. Of those, then we had 16 who are partner organizations, both continental and local partners. So for the literature review, which was a landscaping of policies and institutions, we found out that we reviewed over 200 documents. And for these, we found many countries have not carried any georeferenced data on dog densities or populations. Most dog population figures in the literature were just pure guesstimates. And dog population management is literally lacking in most countries in Africa, and people most rely on culling of dogs. So now the literature is all academic based on monitoring, surveillance, and virus typing. And there was not enough quantity data to help plans, especially in rabies, and most especially in dog population management. So the literature gap is that there's insufficient economic planning and institutional data to do One Health projects, and very little literature to guide policy formulation, how to undertake and design dog population management programs in countries. So now, when it comes to the online survey, I'll just present to you the data for dog population management. And to begin with, we found 74% of the countries had no georeferenced dog census or wildlife census. And you'll understand why we brought in wildlife later on. So now the point is that not only do they have national, but even some do not have small unit censuses that people take when they have programs. So with that, there is a lack of reliable data on rabies mortality and morbidity. So that enhances that when they go out and ask for budgets and talk to technocrats and politicians, it's hard to bring out the story of dog population management and rabies. At least 69% of the CVOs had no idea when their national census is done. But at least 16 countries, they have been having censuses, some every 1, 5, or 10 years, and about 4 countries actually integrate dogs within their census. And of these, when we asked, 26% of the countries just had pure guesstimates on dog populations. And as you see with dog population management, you at least need to know how many dogs you are, where they are, what type of populations, and who are the people who have these dogs. Otherwise, your program in either dog population management or rabies elimination will not go far. It will just be guessing all the way. So when it comes to dog population management, at least 87% of the CVOs believe that vaccinations need to be accompanied by dog population management. So it cannot be done alone, and DPM is a very major factor. And of the 39 CVOs, they believe that the dog population management education needs to be carried out in African level, in schools, by chiefs and religious leaders and a lot of influencers. Because in Africa, most people still are very deep in religion, one religion or another. People go to school, and then we're starting to have both influencers at the senior level and at the youth at the younger level. 85% of the CVOs believe that dog population management is intrinsic and important for wildlife. As you know, in Africa, we just have a green belt in the middle, but the north is the Sahel and the south is the Sahara. So almost 2/3 of Africa is cattle wildlife territory, and people live next to each other with wildlife and territory. And everyone who lives next to wildlife have dogs. So those dogs and their population and how they're brought up and how they're maintained affect the wildlife population, especially small mammals, um, big cats, and wild dogs. And we've had cases where dogs have gone in and they have had outbreaks of diseases like distemper and rabies that have actually wiped out whole packs of wild dogs and even packs of lions. And as we know, they're all endangered and very important with the balance of the ecosystems in Africa. Therefore, the dog and its management is very important for wildlife in Africa. So now when it comes to wildlife rabies management, as you put there, it's just the lack of funding, no dog census, inadequate surveillance, no exposure to the dog populations, and hunting dogs are not regulated. And people who own dogs around those places are not taught or understand how to properly manage their dogs so they don't interfere with the wildlife and wildlife systems. So now when it came to gender and vulnerability of who takes the dogs for vaccination, we mostly saw it was mostly boys and rarely girls. But then there is one country where it was surprising, where it was the women and the girl child who are really in charge of the dog. And then when it came to people living with disabilities, they didn't know if at all and if ever they came, and those who knew were like they rarely came to bring their dogs. And the reason about this is that this data was taken to understand in which direction and in whom the training on dog population management and rabies needs to be integrated in society. Because how do you design the programs on dog population management if you have no understanding in countries or in villages or in level who exactly is the person who takes care of the dog most of the time within the compound and within the villages? Apart from that, we have people with disabilities who, many of them, some live by themselves or they live in communities and they have dogs. Have we understood how we can help them integrate and take care of dogs amongst themselves with their disabilities and how to source help for their dogs? And that's a question that really came up. So now, when we're asking about political support, why it's not transitioning into budgets, guidelines, or change of regulations, most of the partners had no idea. Very few knew. Or if there were any legal instruments. So now most partners do not know if there are any legal instruments, whether it's dog population management, responsible dog ownership, and 5% of the CVOs. At least 62% said in their countries there are none. There are no regulations on dog population management, responsible dog ownership, or rabies. But out of those, 33% said in their countries they do have. And 13% of the partners say they did. The thing with Africa is that most of the regulations in Africa are the regulations that were there post-colonial period. Some countries updated their regulations in the 70s and 80s, but most of them at present, most of the regulations are very backward in the area of dog population management and rabies prevention, and really do need to be updated when we're talking about the goals of reaching 2030, basically, and with the new trends and learnings when it comes to the area of dog population management. So now the reason I'm going to use here, both the terminology is mostly rabies, but with the CVOs and the county public health officers, they integrated rabies and dog population management. And they say the only time it gets high priority amongst politicians is when there's a rabies outbreak or an outbreak of dogs biting and injuring people. And that's a time now the politician comes, they make availability of vaccines, they attend World Rabies Day, they make all those commitments, and then there are those programs for community sensitization. But once the issue has gone and they have got their political points, they disappear, never to be seen again until the next incident. And the main reason they said is that these people do not actually understand the impact of dogs in communities in general, whether it comes to livestock, wildlife, or the human impact. They have lack of resources, and They do not understand how many human beings are infected, because many of them do not have the data, how many livestock are infected, and how many wildlife species are literally infected. And they said if they knew and then understand this, then they would move. And to see how important dog population management is as a whole when it comes to Africa is that we have seen in Africa that, as you said, livestock is a major component in Africa, and where livestock are, the people who keep livestock are literally the dog owners and the dog keepers. And in Africa, when we did the literature review, we found that Africa loses up to, I think, 200 million US dollars annually for loss in GDP and from loss of livestock. And this is livestock impacted by rabies and dog population management factors, which is a really high value. So now when it came to institutional capacity, as you can see, people had quite a bit of training, some very high training like epidemiology of disease surveillance, and maybe very little training like veterinary disaster response and human first aid. But if you notice, there's no institutional capacity trainings that have been carried out for dog population management, whether at the technical level, in the vet departments, or at the education level within schools and school teachers. And unless you have that, then there'll always be an issue of dog population management. How do we expect the drive for dog population management to move in Africa? So when it came to monitoring and surveillance, we were talking about transboundary, because as you know, dogs have no borders. And someone will come to Ghana, buy a dog, and go across to Togo with their dog because it's a good dog. And out of these, as we said, at least 18 countries had transboundary regulations on dogs being transported back and forth, but they did not have vaccination regulations on those dogs. At least 31% of the countries had not only transboundary coordinations, but there were also regulations on vaccine and health in general of dogs in transit. But of 51% of the countries in Africa, they really didn't have that. So some of these bordering countries, you pick your dog, you put it in the car, you go across the border, voila, you're not asked what is the health of the dog, how old is it vaccinated, and you just go across. And that's going to really bring issues when we're seeing how we're going to manage dogs, their populations, and disease transfer in countries, because we know in Africa, zoonotically, dogs will not only spread rabies amongst humans, we see they can do distemper within wildlife, and also, as we know, quite a number of skin diseases and worms that dogs carry can be shared across with livestock, and especially small children who are around them. So if we don't have this understanding and we don't have proper regulations and proper healthcare systems, then we're actually going to continue going in a continuous loop when it comes to human-dog the human-dog livestock cycle in some of these diseases, and not coming to appropriate conclusions. So now when people were asked about coordination of rabies and dog population management, when it came to the continental bodies like the AU, WHO, and AU, when it came to AU-IBAR and AU-CDC, most people said it was far below expectation, that these guys literally don't help them as much as they would need. When it came to regional coordination, and when regional coordination is where we have technical support of FAO, WHO, and regional economic bodies, it was, yes, below expectations, but not as badly as for the continental coordination, because we have some regional economic bodies like the West African ECOWAS, which is for West Africa, and the Central Africa one, where those regional economic bodies actually do have strategies when it comes to rabies and dog population management. So now it's them now translating it at country level for country levels to expand it. And the other thing was, is they were saying, is when it comes, so one country will be working with FAO, another country will be working with WHO, and another country working with OIE, and some in neighboring countries, but they do not coordinate these offices across neighboring countries. So now everything is happening in parallel instead of it being parallel silos, instead of them working in coordination, so that this disjointed working is not helping matters in this area. So now, as we said, for national coordination, there is inadequate intersectoral coordination, poor technical and institutional coordination. At least 62 CVOs said there is no laws providing robust institutional frameworks for the national rabies strategies and dog population management. At least 72 countries were somewhere in beginning these strategies. 18 countries had specific laws, and 11 countries had rabies plans that integrated dog population management. So now, CVOs attributed the poor coordination, I said, mostly to lack of good leadership and mainly lack of technical support and awareness. And we said without even the lack of georeference population on data and dogs. So now, as we said, 72 countries at the beginning of their national stages, 8% have completed, 10 are in advanced stage, and 10 are developed. The goodness is within all these strategies, dog population management have been put within the strategies. But yes, the strategies come in, they have dog population management, but where are the budgets to undertake it? And where is the training for the people who are going to integrate this at country level down to the local level on dog population management? And that's where the question comes in again. So now, as you know, in Africa, we use the SARE to help develop plans and see where you're going. And when it came to SARE, there was an issue about dog population management. Yes, it helped you outline where your failings are, but it didn't help you see how to build your dog population management strategy or phases like the other integrated areas. So now, as we see, we have the rabies budgets, which started high, went low, then went up again. When COVID came, they totally almost went zero. And when it comes to budgets compared to zoonotic diseases, you'll notice dog population management does not appear. So unlike the others who have small minimal budgets within the zoonotic disease budgets, dog population management does not appear within agricultural budgets and livestock budgets. So now, this is the current gap in rabies elimination. And as you can see, dog population management and lack of data is given an 18% review. At national level, implementation of dog population management is higher because at 23%, they say at least 23% of them said it's very important. And at continental level, they asked for, when it comes to dog population management, it was a technical training, which was at the top at 20%, but also, as I say, implementation and improvement at 8% when it comes to continental level. So now you can see the study recommendations in general as a whole, but you can see dog population management was one of the major areas. So now what we came up with and we said as recommendation in dog population management is, one, you need to create relevant awareness of national rabies elimination strategy and dog population management in parliamentary committees and higher technical levels. You need to create awareness of dog population management and improve dog welfare and understanding as a general within communities. And you need to lobby parliamentarians and high-level government officials to update laws and enforce dog population management and responsible dog ownership. Apart from that, we need capacity building in communities, capacity building at border public health and security areas when it comes to monitoring dog in transit, training of veterinary technicians at all levels, not only in mass dog vaccination, but dog population management system as a whole, develop and compile dog population management knowledge, guidelines and training, and capacity build and train dog population management consultants and trainers of trainers at all levels in every country in Africa. Apart from that, very major also came out studies of dog ecology and epidemiology that's needed to guide the direction of these programs, undertake georeference and specific census of dogs and wildlife, and incorporate gender-based programs in dog population management, training, and awareness. And also we need the governments to mobilize and increase their financial vote in the animal health sector and to dog population management, and to get development partners to mobilize resources at continental, regional, national levels for dog population management in Africa. So now at this place, I'd like to say thank you. I'm sure the slides will be shared so you can go through it. But if you have any questions, do feel free to get in contact with me or Dr. Hiver at AU-IBAR. Thank you very much.